So when evaluating how risky a prostate cancer is, there are really three factors that we take a look at. The first is the PSA blood test. The second is the Gleason grade group, that is how aggressive it looks underneath the microscope. And then finally the T&M staging. So whenever we do the rectal exam and whenever we do the imaging, how locally advanced does the prostate cancer seem to be within the prostate gland itself? So when we take a look at each of these factors, there are criteria that classify them as low risk, intermediate risk, or high risk categories. For the PSA, a value below 10 would classify as a low risk category. Between 10 and 20 is intermediate risk, and above 20 would be a high risk feature. For the Gleason grade group, this is scored on a scale of 1 to 5, 1 being the least aggressive and 5 being the most aggressive. 1 is a low risk feature, whereas 4 and 5 are high risk, and 2 to 3 are somewhere in the middle, intermediate risk. And then finally for T&M staging, something between T1 to T2A essentially means that the prostate cancer takes up a small percentage of the prostate gland. For T2B to T2C, the prostate cancer is taking up a more substantial percentage of the prostate gland. And then finally for T3A or higher, the prostate cancer is found to be spreading outside of the prostate gland itself. So either rupturing beyond the prostate capsule, invading into the seminal vesicles, or potentially even beyond that.